Asthma is a prevalent condition that affects millions of people worldwide. Having a good understanding of this condition can be essential in managing your health. Today, we will discuss this crucial topic in detail, so let's explore the world of asthma. Before we start, subscribe and click the notification bell for our health insights. To start, what is asthma? Asthma is a chronic respiratory condition that affects your airways. It can challenge breathing, and here's how. Imagine your airways are like tubes. When you have asthma, these tubes become inflamed and narrow, making it harder for air to flow through. This can lead to symptoms like coughing, wheezing, and shortness of breath. Let's take a closer look at the physiology of asthma. When you encounter a trigger, your airways become irritated and swell. This leads to mucus production and muscle constriction, causing typical asthma symptoms. Now, let's talk about the symptoms. Asthma symptoms can vary from person to person, but the most common ones include coughing, especially at night or early in the morning. Wheezing, which is a whistling sound when breathing. Shortness of breath. Chest tightness. So, what causes asthma? It's a combination of genetic and environmental factors. If you have a family history of asthma, you might be more at risk. But let's talk about triggers. These are things that can worsen your asthma symptoms. Common triggers include allergens like pollen, dust mites, and pet dander. Respiratory infections, like the common cold. Smoke, air pollution, and strong odors. Physical activity can lead to exercise-induced asthma. Weather changes, especially cold and dry air. Stress and strong emotions can also be triggers for some. Right, here comes the critical part, asthma treatment. The good news is that asthma can be managed effectively. Treatment typically involves two main types of medications. Relievers, these are your quick-acting rescue inhalers, like albuterol or salbutamol. They provide rapid relief during asthma attacks or when you're experiencing symptoms. Controllers, these are long-term medications that help control inflammation and prevent symptoms. They're usually inhaled corticosteroids, leukotriene modifiers, or long-acting beta agonists. Medication management is crucial, and you should work closely with your healthcare provider to find the right treatment plan. Remember that there is no one-size-fits-all approach to asthma management. Before we wrap up, here are some more in-depth tips for managing asthma effectively. Asthma Action Plan. Work with your healthcare provider to create a personalized asthma action plan. This plan will outline how to manage your asthma, including what medications to take and when, how to recognize worsening symptoms, and when to seek emergency care. Trigger avoidance. Identify and avoid your asthma triggers as much as possible. This may involve changing your home environment, like using allergen-proof covers on your bedding or installing air purifiers. Medication adherence. Taking your medications as prescribed is crucial, even when feeling good. Consistency is critical to maintaining control over your asthma. Physical activity. Staying active is essential for overall health. If you have exercise-induced asthma, talk to your healthcare provider about strategies to manage it. These may include using your inhaler before exercise and warming up properly. Stress management. Learn stress management techniques, such as deep breathing exercises, mindfulness, or yoga. These practices can help you manage stress. Annual checkups. Regular follow-up appointments with your healthcare provider are essential. They'll assess your asthma control, adjust your treatment plan if necessary, and address any concerns or questions you may have. Now, I want to hear from you. Have you or someone you know been affected by asthma? What questions do you have about this condition? Please share your thoughts in the comments below, and let's start a conversation. Asthma is a common condition, but with the proper knowledge and care, you can lead a whole and active life. Remember, understanding your triggers, having an asthma action plan, and taking your medications as prescribed are essential to successful management. If you found this video helpful, please give it a thumbs up and subscribe for more health-related content. Thanks for joining us today, and stay well.